You are committed enough to always be there, organised enough to supply the fuel, and passionate enough to cheer on the team. But unless you're smart enough to recognise the signs of concussion in your family members and responsible enough to watch for symptoms after they've been removed, then they are at risk of serious injury. Hi, I'm Alan Quinlan and I'm here at the Aviva Stadium in Dublin to talk about your role as a family member in managing concussion. This venue is somewhat appropriate as many Irish rugby players aspire to one day play here. And while hurdles can stand in the way of this goal, one such hurdle, if not managed correctly, is concussion. The IRFU has put together 4 simple messages as guidelines in the management of concussion. These are stop, inform, rest, return. This video will detail your role within each of these guidelines so that you will know exactly what to do from the time a family member has suspected concussion to the time that they return to play. First though, let's find out what concussion is, how it can occur, and the signs and symptoms to look for.
Concussion is a traumatic brain injury that affects how the brain functions, resulting from the brain colliding with the inside of the skull. Concussion can be caused by a direct blow to the head or body, and from whiplash-type movements occurring when a player collides with another player or the ground. This injury can take place during training as well as during a match. If not managed correctly, concussion can result in a shortened playing career, a more serious brain injury, permanent neurological impairment, and even death. Children and adolescents are more susceptible to concussion and to developing more serious complications. Children and adolescents can have symptoms that take longer to develop and can take longer to resolve. A player does not need to lose consciousness for concussion to occur. In fact, only 10% of concussions result in loss of consciousness, which is why understanding the signs and symptoms of concussion is so important. A sign of concussion is something seen by you, while a symptom of concussion is something the player might complain of to you. Signs to look for on the field are a player lying motionless on the ground, a player who is slow to get up, unsteady, or falling over, a player who is grabbing or clutching their head, a player who has a dazed, blank, or vacant look, a player who is confused or not aware of their surroundings, and a player who is vomiting. Symptoms a player may complain of off the field can be divided into 4 categories. Physical, how the player is. Emotional, how the player feels. Cognitive, how the player thinks. And sleep, how alert the player is. Physically, a player may complain of headache, sickness, balance problems, or dizziness. Emotionally, a player may feel irritable, they may be aggressive, more emotional, or more nervous or anxious. Cognitively, a player may have memory problems, confusion or forgetfulness, or feel slowed down. Sleep-wise, a player may be drowsy, and they may sleep more or less than normal. Symptoms of concussion can come on immediately or up to 48 hours later, meaning players might be at school or work when they experience them.
Now that we know what concussion is, how it is caused, and the signs and symptoms, we can look at your role in the first of the 4 guidelines. Stop. If you suspect a family member may have concussion, you must notify the coach. Once they have been safely removed, monitor the player for symptoms. They must not be left alone or allowed to drive. The next step in the management of concussion is to inform. Inform. You should inform the family member of their need to see a doctor and for them to inform their school or work. If you are a parent or guardian of a young player, you should take them to see a doctor and you should inform their school or work of the suspected concussion. Rest. Following a suspected concussion, the family member must have appropriate mental and physical rest. They should avoid playing video games, using mobile phones and computers until symptom-free. They must not train or play in any sports or partake in any physical activity for a minimum of 14 days. Return. you should advise the family member to follow the graduated return to play protocol and that they should have medical clearance before they are ready to return to play. To explain the graduated return to play protocol, here is rugby coach Noel McNamara.
The graduated return to play protocol involves 6 stages. A player must be symptom-free at each stage in order to progress. If the player complains of any symptoms, they must return to the previous stage. The first stage involves 14 days of complete mental and physical rest. The second stage involves the player undertaking low to moderate intensity activity, such as walking, swimming or stationary cycling. The duration for this stage for adult players is 1 day, and for junior players between under 6 and under 20s, it is 2 days. If the player is symptom-free during this stage, they can move to the third stage, which involves rugby-specific exercise, such as running drills. This period must not involve any impact activities, and the duration is again 1 day for adults and 2 days for junior players. If the player remains symptom-free, they can move to the fourth stage, involving more complex, non-contact training drills, such as passing and catching, and the player can start progressive resistance training. The duration is again 1 day for adults and 2 days for junior players. Following medical clearance, the player can then progress to the fifth stage, involving normal training activities to restore confidence and so that they can be assessed by the coaching staff. The duration for this period is 2 days for both adult and junior players. 24 hours after this stage, and providing they remain symptom-free, the player is ready to return to play. The minimum time of return following the suspected concussive event is no less than 21 days for adults and 23 days for junior players. Bringing a player back before this period is not only putting their life at risk, but will likely lead to a poor performance by that player, meaning no advantage will be gained by your team.
To recap, concussion is a brain injury caused by contact to the head or body, or whiplash injuries. Concussion can lead to permanent loss of mental function and even death. Signs and symptoms are observed on and off the field and can occur up to 48 hours after a concussive event. If you recognise concussion in your family member, they must be removed from the field immediately. You must monitor them for symptoms and advise them to inform a doctor. If you are a parent or guardian, you should take them to a doctor and inform their school or work. Ensure they follow the GRTP protocol. Encouraging players back early not only endangers their lives, but will lead to poor performance. Finally, as a family member, you are an influential figure in the eyes of the player. If you pass on the information contained in this video and emphasize the importance of managing concussion safely, you will help change the culture of concussion and ensure the safety of your players. For more information on concussion, including videos for junior and senior players, coaches and referees, go to irishrugby.ie. If you would like to attend a Safe Rugby course to learn practical rugby-specific first aid, or if you have any questions regarding concussion, go to irishrugby.ie and search SAFE. You can email saferugby@irishrugby.ie or call 086 021 6064. And remember,
Stop.
Inform. Rest.
Return.